Good morning, my dear students. I am here for the clinical nutraceutical pharmacy. Nutraceutical pharmacy. I will have three lectures that belongs to nutritional education. So today is the first lecture of nutritional education. Please be informed that all the lectures, everything, I will upload one day earlier than your lecture date, 1 or 2 days earlier. So we will follow the same throughout the academic year. So usually I upload all the related lectures 1 day or 2 days earlier than your current lecture. So we only have 8 participants. We can just wait for a few more minutes. The participant can be joined, then we can continue. Later we will give you this video. And then you can have a look onto that, because it was instruction given to me that we will give the videos to the student, and the student will decide that whether they want to take this subject as an elective subject or no. So later we will give you this video. So let me start now. Okay, so nutraceutical education. Education is actually, we will cover in this topic, we will cover about the concept of nutritional education with the goals, the basic of nutrition and major nutrient and their sources. And the third one is the standard hospital diet and indication of clinical and hospital settings. So we will discuss with this. We will further we will study about this. Okay, so let's continue. These are the subtopics, so we will discuss about this. I have already covered the subtopic. We will have this one. Then the topic learning outcomes will be from this subtopic. The topic learning outcome will be at the end of the lecture. You will be able to explain the concept of nutrition education, describe the basics of nutrition and major nutrient. Then you will be able to appraise and differentiate between the standard hospital diets. So let's continue. Introduction. Nutritional education can be defined as the set of learning experiences designed to facilitate the volunteer adoption of eating and other nutrition related behavior conducive to health or well-being. Nutrition education is the process of teaching the science of a nutrient to an individual or group. So basically, actually, the nutritional education belongs to the teaching, to the telling to the patient that which kind of nutrition the patient is needed, which kind of the food the patient has to take. And we because we know that there are some of the diseases, some are the diseases are the chronic, some are the diseases they belongs to the chronic condition, or some are acute. But nutrition requirement is for both. Sometimes for the acute diseases, we give the nutritional requirement. We tell to the patient that this food is contraindicated to you, this food you have to take, this food you should not take. We tell the patient. And moreover, it is more important into the chronic kind of diseases like hypertension, diabetes mellitus, dyslipidemia. If let's say the patient is already having hypertension, we will tell the patient that which kind of food the patient can take and which kind of food the patient should not take, and which kind of food is in if the patient is taking, it should be in a low potency, low quantity, mean the quantity should be very less. So mean that we need to tell to the patient, we need to give the education, nutritional education to the patient, and telling them that which food they should eat, which food they should not eat. And then similarly, what kind of food we recommend for that diseases, means sometimes if let's say the patient is in that condition, we need to take a vitamin K, or sometimes we need to give anticoagulant property, sometimes coagulation property. So we will tell that the patient has to take iron more. If iron more, then which fruits the patient has to take. If let's say the patient need green vegetable, so which are the vegetables the patient can take, and how to take that vegetable to the patient, either it is in the cooked form, it is in the fried form, which form the patient has to take. So these kind of things we need to tell. So this all will cover under the nutritional education. Not only talking about the information regarding the nutrition, but also a physical activity, mean that what kind of physical activity the patient should perform, what kind of physical activity patient should not perform, and what are the kind of a life modification, what kind of diet modification patient has to follow. So we will tell to the patient. This is all about the nutritional education. And then now you see, I don't know why it is not going. Just a moment. Okay. So nutritional education by healthcare providers. Nutritional education is, as you know, that nutritional education has to provided by the healthcare providers. Some of the hospitals they do have. Some hospital they do have which name of some dietitians inside the hospital. They do have dietitians, and most of the time, if the hospital or clinic they don't have a proper dietitian to guide the patient, then definitely that kind of hospital, where in that kind of hospital, healthcare providers has to put their own efforts. So which means that being a healthcare provider, not only the nutritional is not only the requirement from the nutritionist, but also it is actually comes under all the healthcare providers. So healthcare professionals have a different role in educating an individual in clinic, community, or long-term healthcare facilities. So they have different roles. They have different roles about that. They have a different kind of roles and duties to the patient, to tell the patient about the nutritional requirement, about the diet. In these settings, the dietitian, nutritionist, or nurse serves to assist or enable individual incorporate the changes eating pattern and behavior into their lives. So mean that in the hospital setting, in a healthcare setting, healthcare system, the patient need an education. So how we will give the education to the patient? We will tell to the patient that being a healthcare providers, we will tell to the patient that this kind of food is recommended for you, and this food is not recommended to you. So similarly, we need to tell to the patient, and then we need to give an education to the patient, being a healthcare provider, because we are the healthcare providers. The pharmacist comes under the healthcare provider. If our hospital does not have a proper healthcare facility, proper healthcare dietitian, then we need to provide the help. We need to provide help to the patient to control their disease. And then the major focus of this type of nutrition is not only knowledge and fact, but rather development of permanent behavior changes. That's what I told. Some of the diseases, they belongs to lifestyle modification diseases, like diabetes mellitus. It will continue with the patient's life. It won't finish. Similarly, hypertension will continue with the patient. If the patient is having obesity, then the patient has to modify his or her lifestyle. So mean that we will educate the patient. If sometime the patient is not well, then we need to provide an education to the patient family member, patient caretakers, or all, we need to provide an education to them. So it's not only to the patient, because sometimes also to the family members. So being a healthcare provider, we need to tell them which are the lifestyle modification they have to do, which kind of a lifestyle they have to adopt, which kind of a pattern they should be. Usually being a pharmacist, we will tell the patient like this kind of the disease, this kind of a diet you should take, what time you should take the medication, what time you should take the diet. If the drug is recommended to take with food, or drug is without food, drug should be taken with milk, drug should be taken without milk, or drug should be taken with water, drug should be taken while fasting condition. So these all, which drug we need to take in night, like simvastatin. So we need to tell to the patient. This is all about the healthcare providers responsibility. And some of the hospital now in Malaysia, they started MTech services. MTech services are actually where the pharmacist role is already there. So mean that the pharmacist will be there, pharmacist will tell the patient about the patient disease. So they will explain to the patient, if you don't take the medication on time, what will be the consequences later on, what kind of a complication you will have later on. So pharmacist will explain to the patient, and then the patient will develop the inside the patient will develop like the habits to adopt the changes whatever the pharmacist is recommending. So by this way, pharmacists or healthcare providers, they will educate the patient what to take, what to kind of the modification needed, what kind of a lifestyle they need, what kind of exercise is needed, what kind of nutrition is required. So this kind of things the pharmacists or the healthcare providers will teach to the patient. This is an art of nutritional education breakdown, breaking down a large body of knowledge into a small individual component that represent to patient or a client at a rate at a lower level at which they are able to absorb and use the information. So mean that if because we need to ask the patient about their education. If patient is not educated well, then we need to explain the things to the patient in such a way that they should understand the thing, they should understand. So mean that we need to tell to the patient into their own language, their own understanding. We need to make sure that the patients are getting proper education and they are absorbing that education as well. So we need to tell to the patient that okay, we if we tell them in a medical terminology, definitely they won't understand. So we will make it as a so simplest way to tell the patient that which kind of drug, which kind of food, which kind of lifestyle modification is required. So we will tell to the patient in such a way. Then the next thing is nutritional educational goals. Nutritional educational goals, definitely our main goal, our major goal is to control the disease. But apart from that, to create a positive attitude toward good nutrition and a physical activity and provide motivation for improved nutrition and lifestyle practices conducted to promoting the maintaining the best attainable level of wellness for the individual. So first of all, we need to provide such an education that they should be developing a positive attitude for the nutritional requirement, for the nutritional modification, and we need to motivate them. We need to tell them that because that is the thing why we need to tell the patient about the disease. Your disease is this one. Then if you don't take care about the disease, definitely you will have a proper later on complications will be there. So here we need to explain to the patient about all the consequences of the disease. Then the next one is to provide adequate knowledge and skill necessary for critical thinking regarding diet and health, so the individual can make healthy food choices from an increasing complex food supply. So we need to provide an education, proper knowledge to the patient. We need to provide the knowledge of the patient, so that we need to tell them that which kind of diet actually they need into from, because we when we talk about the diet, the patient does not know, because lot of diets are available in the home. Maybe the others are feeling well, they don't have any chronic disease, But if our patient is having chronic disease, what kind of food the patient can be taken, what kind of the food patient should not be taken, we need to explain to the patient. So mean that we will provide proper education, proper knowledge about the disease, so that the patient should critically think about the diet. When the diet comes in, patient should critically think that whether this disease is really I can take this diet as a proper diet in my disease or not. Mean that if, let's say, for example, the patient is having hypertension, so when we give the diet to the patient should think that whether it is if the salt is too much, the salt intake should be less in hypertension. Then the patient has to think, if I take this food with the salt or with the table salt and all, then definitely my blood pressure will increase. So patient will think in such a way, then the patient critically will think that I should not take the drug, this food. Similarly, it goes to diabetes mellitus. If the patient is having a complication and diabetes mellitus is not getting control, if someone is giving or offering food to the patient, the sweet food, patient will not take the sweet food, because you know that if we take the sweet food, definitely it will increase my blood glucose level. So in this way, proper kind of a critical thinking we will develop into the patient. Then the third one is to assess the individual to identify resources for continuing assessment of sound food and nutritional information. So the patient should, we will give a proper education to the patient about the nutritional information. So which food is having more nutrition, which food does not have nutrition. If we cook a food in this way, how much the nutrition will be there. If someone is getting a fried food, then definitely some of the nutrition is destroying. If destroying mean, what quantity the patient should take and all. So with this kind of all information we need to provide to the patient. This is our goals for the nutritional education. Then nutritional education content is actually not specified to any guideline, but also we do have some of the guideline. In Malaysia, we do have all the diseases guideline. In that disease guideline, the lifestyle modification or diet control guideline is already a part of that. Mean that if the guideline belong to hypertension, then the lifestyle modification diet intake is a separate kind of heading inside that guideline. So from that we need to take an extract, we need to abstract the things and tell to the patient. If we don't have that, then WHO guidelines are available, NICE guidelines are available, many of the dietitian guidelines are available online. We can download and tell to the patient. Nutritionists, they do have this kind of things, but being a pharmacist, usually we require to tell the patient in a chronic diseases that which kind of food the patient can be taken, which kind of food the patient should not be taken, which kind of lifestyle modification we require. In Malaysia, in Malaysia nowadays, the pharmacist is doing these kind of services in MTech services in all the hospitals, all the tertiary care hospitals. Then the next one, the nutrition education program makes available information and guidance pertaining to the nutrition, will make sure that the guidelines are available, and their nutritional program will cover the things. What are the guidelines pertaining to what kind of things we need to achieve, what kind of the guidelines should be pertaining to what. So first of all, this is the food, including the kinds and amount of food that required to meet one's daily nutritional requirement. If, let's say, we tell to the patient that you have to take apple every day, so how much is the quantity and how he should take, the patient should. If, let's say, in the evening, morning, or what time, otherwise patient does not know that patient, whether he has to take the food as it is, or patient can add salt on that, patient can make a blend, patient can take a juice of that apple, or what we need to tell to the patient. So how the patient should take that, whether the patient has to take it as it is, or patient can bite it, patient can cut that and take half of that, So how the patient and which kind of fruit the patient can take. Let's say, for example, diabetes mellitus patient whether patient can take apple, or patient can take bananas, patient can take mangoes. So we need to tell to the patient, we need to give a proper education to the patient that which kind of food the patient can take and what could be the quantity, the amount of food that the patient can take. Okay, then next one is the nutrition. Include the combination of process by which the body receives substances uh, necessary to maintaining its function and growth and renewal of its component like ingestion, digestion, absorption, metabolism, elimination. So what kind of nutrition is there? We can tell if, let's say, green vegetable, which vitamins are there inside that vegetable. If the other vegetable like beans, what kind of what kind of vitamins are there inside? How they can cook that food? How they can make that food to make sure that the nutrition there inside it should be good enough. If we ask the patient to take a boiled egg, so how much the egg should be boiled, if the egg is boiling and then later on it covers all the yolk is covered by the black color or became black, or then definitely some of the nutrition is already destroyed. Or similarly some other kind of the food, if let's say you're making your own food, you're making some gravy and you're putting more oil in that, definitely it's not good for the health, so nutritional requirement will be excessive. So if the patient is already having a hyperdyslipidemia, patient his cholesterol level is very high and patient is taking fried food, definitely it should not be taken. So we need to explain to the patient what kind of a food patient can take and what kind of nutrition is there inside that food and how to take and what amount of food is required for performing the daily activities for the body of the patient. We need to explain that to the patient. And then the third one, behavior practices, including the factors which influence one's eating and food preparation habits. So how they can make the food, we need to explain the behavior changes. We need to tell, when previously the patient was taking all the fried food, now we need to explain to the patient that should not be taken, or if it is required, what kind of amount can be taken. So we need to explain about the practices, about the behavior to the patient. And then consumers issue, including the management of a food purchases power to obtain maximum food value for the money spent. So in the specific amount of money, what kind of food patient can buy, which kind of food patient should buy, and in that amount what are the other things the patient can buy. So we need to explain to the patient, so that the patient should know that what is actually the amount, the money value, and in that money value the patient spend that value of money into a proper place. Then information on physical activity, we need to explain to the patient how the physical activities are important, how much the physical activity is important. Is if dyslipidemia is there, we need to explain to the patient that you are taking the medication is okay, but still you have to do exercise. What kind of exercise patient can do? If let's say patient is hyperlipidemia and then the patient is having diabetes also, we need to tell to the patient you can take a little bit exercise, not a very severe exercise, because very severe exercise, if your hypoglycemia happens, then it could be dangerous. So we need to explain to the patient that what kind of a lifestyle modification is required, what kind of physical activity is required from you, which kind of physical activity, and how much the total times patient can spend on a physical activity. We sometimes the patient, they are not having a very good knowledge on the disease. We need to tell them maybe around 10 minutes you can spend in the morning, maybe 10 minutes in the evening, 10 minutes in the afternoon, something like that. We need to explain to the patient about the physical activities. Then information on the roles of nutrition and physical activity in maintaining health and independence and preventing the managing chronic diseases such as diabetes, heart diseases, high blood pressure, osteoporosis, arthritis. So information regarding the role of nutrition and physical activity. What are the physical activities are there into the patient who is having diabetes mellitus? Definitely we can tell to the patient, if let's say previously your blood glucose level is 6.2, but if you take every day 30-minute walk, definitely your blood glucose level, the studies proven that 3 to 4 is already decreasing every day, if like that. So we need to explain to the patient, you can take the food, you can take the food, or you can take the drugs as it is, which we recommended to you, but still the patient need to do walk, need to do the physical activity. If physical activity, it will boost out the drugs effect, then the blood glucose level will be controlled soon. So we need to explain to the patient. Similarly, for high blood pressure, you need to tell to the patient that the exercise is important, physical activity is important, salt intake should be less. So we need to explain. And similarly, in osteoporosis also, we need to tell to the patient. So the proper education need to provide to the patient. That is actually our nutrition education pertaining to these kind of informations. So these are the 6 steps. Then nutritional adequacy, how we consider as a nutritional adequacy. Nutritional education is defined as the sufficient intake of essential nutrients need to fulfill the nutritional requirement of our optical health. Sometimes the normal human beings, normal persons, they went to the dietitian because they are worried about their health. Sometimes the patient, sometimes we do receive a patient, those who are not actually the patient, they don't have any kind of chronic disease, but their family members, they do have this kind of the history of their diseases. Maybe sometime the patient family members, they got heart attack, they got hypertension, they got heart diseases, CKD, so they know that in this disease is there into our family. With this disease, we may get inherited. So then they will contact to the dietitian and ask, okay, what kind of food I should take to avoid that this disease should not be there into my body. This the harmful effect should not be there into my body. So then the nutritional requirement, we need to tell what are the amount of food you can take, which kind of food you can take. So we need to explain. That is called as a nutritional adequacy. Then the criteria of adequacy of nutrition intake. The first of all is prevention of the prevention of deficiency of disease deficiency. We need to decrease, we need to prevent. Then prevention of chronic diseases. So when we talk about the nutritional adequacy, nutrition intake adequacy, then we definitely talk about to decrease the drug use, to decrease the disease, to decrease the chronic diseases, to decrease the other diseases, and to reduce the risk of diet associated diseases. Some of the diseases, they are directly associated with the diet and lifestyle modification. So that also we can decrease with the help of nutrition adequacy. Then the subclinical nutrition health condition identified by a specific biochemical or functional measures, and moreover requirement to maintain a physical balance. So we can give this education to the patient. We can tell them that this is these are the things we need to tell to the patient, and then we can explain that what kind of a disease should be there, what kind of a lifestyle modification should be there, and how that can be considered as an adequation nutrition. So these are our goals. Actually, we ultimately want to decrease the disease outcome, disease management. We want to decrease the disease prevalence into the specific amount of the patients. Then Mediterranean diet is actually the diet considered as the healthiest diet pattern. Sometimes sometimes the patient, they go to dietitian, and the dietitian is required to draw a proper diet plan to the patient. So that diet plan, the dietitian will tell that which amount of food when to take. So from the morning until evening, the dietitian will draw a diet plan that is considered as the proper diet, and that proper diet is considered as Mediterranean diet. So in that diet, actually, most of the time, that diet is having a fruits inside, having a vegetables inside, then maybe the green vegetables or whole grains, or consumption of the high amount of frequency, which amount. So they will tell, when you woke up in the morning, 7 o'clock, you have to take one apple. Then after the half an hour, you can take your bread slice, and then it should not be with butter. If you are hypertensive, or if you are having dyslipidemia, should not be taken with butter. You can add some of the jams on jellies if you don't have diabetes mellitus. So this kind of plan. And then in the lunch you need to take a boiled rice or maybe the cooked rice. Then what kind of amount of the gravy you can put it on that. If your blood glucose level is not very high, so you can take the sweet things, you can take a desserts. But if the blood glucose level is high and then you need to take a proper control diet, then boiled rice with, you can add some amount of the chicken, some amount of the vegetables you can add it, but that should not be fried one. If you are dyslipidemia, if your cholesterol level is high, so then the fried food should not be there. So these are actually proper diet plan that usually the dietitian gives to the patient. So that is considered as the Mediterranean diet. Mediterranean diet usually have a vegetable, fruits and all, but not only that, sometimes it does have, some of the time it does have the other things like chicken, like vegetable, fish, eggs, meat and all. It's there. Sometimes it can be there, but the amount is can be decreased. The amount, the available amount we can decrease. So sometimes our patient need a protein diet, then definitely eggs, chicken and then the fish, it can be given white meat can be given. So if our patient is actually belong to some specific disease that where the protein intake is maximum required maximum, then the dietitian can plan in that way accordingly. Then the next one is the basic of nutrition. The basic of nutrition is living things acquired nutrient in order to serve and to grow and develop normally. Then nutrition are components of food that provide nourishment in order to serve us. Nutrition provide our body's energy, help and build. So our body require the information, require the things, require the carbohydrate, what amount carbohydrate is required, what amount of protein is required, what amount of vitamins are required, which vitamin our body is deficient. If our body does not have the proper this vitamin we don't have, so we will increase the intake of that vitamin. So if potassium level is decreasing to the body, then what kind of food we can take, which fruit that does have potassium in high quantity. If our iron level is less, then food which fruit are having high amount of iron inside, we can tell to the patient. So these are the things we can tell. Actually now we will talk about the major nutritional components. Actually total are the three components. Total three diet components are there as a major nutrition component. They consider your biochemistry. Then the first one is the protein. Protein is actually essentially required from the body to the body to build up and to require its function. And we need protein in order to build and repair body tissue such as muscles, organs or skin. If let's say the patient is having a wounds are there, cuts are there, patient got a major accident, or maybe sometime the patient does have a major surgery, and then in the recovery time patient may need more protein in amount. Similarly, if the patient is having the wound healings, we need to give more protein. Sometimes the patient have a cuts into the body organs, and sometimes the muscle building, to build a muscles, to bring our organs proper function, tissues building, the protein are the required component, the active ingredient we need. That is the thing. Usually in the gyms and all, they ask to take a more protein because the muscles will be building due to the protein. So the amount of protein we can increase. They usually says that. So protein, actually, what are the sources of protein? Sources of protein can be a beef, can be from the chicken, white meat. It can be from the eggs. It can be from the dairy products. It can be from the milk. It can be from the soya products. Vegetables also, sometimes they do have vegetables, they are rich in protein. Sometimes peas are there, nuts are there, seeds are there. Some the seeds, sunflower seeds and all is there. Then the peanut butter or other butters, they do have a protein inside. Remember one thing, the protein major source is the animal. remember one thing: in protein, the major source is from the animal source. Animal source, it can be milk, it can be yogurt, it can be eggs, it can be meat, it can be white meat, it can be red meat, it can be then soya products. Soya product, it do have a protein in the soya products. Then the vegetable also, some of the vegetables, they do have protein inside. And then so these are the sources of proteins. Then carbohydrates are essential nutrients our body needs in order to provide us with energy. So carbohydrates are needed. They are the essential components. They are the essential component to to take to the patient. You remember, we have gone through, maybe you have gone through in your biochemistry, the carbohydrates life cycle. And then at the end of every TCA cycle, every carbohydrate cycle, your body is getting energy in the form of ATPs. So carbohydrates are the major sources of our body to get energy in order to effectively function. So for the energy sources, carbohydrates are considered as the best kind of food. And the in our body, with sugar, starch and fibers. So to increase our blood glucose level, if let's say the patient is having hypotension, patient is blood glucose level is very less, is decreased already, hypoglycemia is there. So the patient need to take sugar, patient need to take starch. So that's the thing. So carbohydrates are the components of food which is actually required to maintain the energy level into the patient. It gives energy level to the patient. But sometimes if we are taking more carbohydrate diets, then it can result into obesity or abnormality in the weight gain. It can be there. Then the sources of carbohydrates, these are the sources. They mostly belongs to the plant source. Breads from all kinds of breads, they do have carbohydrate. Grains, potatoes, beans, rice, boiled rice, brown rice, and all the rice is actually richest source of the carbohydrate. Then the other from our bakery products like cakes, breads, cupcakes, and all. It can be taken. And then the noodles, pasta is there. And then the crackers, all kind of crackers, biscuits, they do have um, carbohydrate. Some of the food that made from the starch kind of things. Then the other thing is the starch food. uh, so these are the kind of sources of carbohydrates we have. Then the fats are also essential nutrients into our diet. Even though we tend to think of fat as bad for us, we do need a certain amount of fat into our diet. Sometimes, we thought that fats, is not good for health. If we take the fats, then the body weight will increase. Or then maybe later on, obesity will be there. We consider that. But still the fat are the component of a diet which actually we need on the daily basis. We need fat into our body every day. We need some of the amount of the fat. Then fats help to protect our organ, necessary to our membrane, in most of the cells in our body. For brain or nerve function, is used to insulate the body and prevent heat losses and carriers of other nutrients. Then the sources of fats, you can take fats from all kind of oils. Can be canola oil, can be blend oil, can be from the any oil, the corn oil, or whatever the oil you are using. Oils are the sources of the fat. They are the richest sources of fats. Then olives are also the best sources from the fat. Then butter, milk, eggs, they do have milk does have a portion of fat. Sometimes the milk, is written that no fat included. They mean that they have processed and they remove the fats components. But we need some of the fat. Then the fats are there into fish. And then the fats are there into the meat. All kind of meat, they do have certain amount of fat. Definitely, if we take the meat from a mutton, from from the muttons, then the fat will be more. If the meat is from the buffalo or some, then the fat component will be high. In chicken, the fat component will be very less. So accordingly, the fat component will be there. So then the margarine, salted dressings, they do have fats. Then peanut butter, they do have fat. Then animal fat found in meat, that also can be the source of fats. So these are all the sources of fats. Then the standard hospital diet, when the patient goes to hospital, and the patient goes to hospital, patient is hospitalized, patient is admitted to the hospital. So hospitals, they do give some of the standard kind of diet. What kind of diet are there into the hospital, so we will explain by today. So first of all, soft diet. First of all, we consider soft diet. It is an adequate diet that is soft in consistency, easy to chew, and then make up of simply easy digestible foods. It's appropriate for patients who have few or no teeth or ill-fitting denture. So then the soft diet is recommended. If let's say the patient has removed the moles or something, the patient is old enough, the teeth, they have removed the teeth, or they have a denture inside, they have denture, sometimes partial denture, sometimes complete dentures are there, though. So they cannot chew the food, they cannot bite on the food. Then we consider as a soft diet as a perfect source for their diet. So we need to give a soft diet. Sometimes the dentures are there but not exactly fitting, the ill-fitted denture, sometimes partial denture, even sometimes no denture also, and the teeth also removed, some of the teeth are removed. Then they cannot bite on the food, they cannot chew the food. Then definitely we need to think and we need to give a soft diet. Then the soft diet indication is they are actually recommended into acute infections. Some of the time infections are there, so we need to give a soft diet. If let's say for example, in all infection is there, and then the candidiasis infections are there, patient cannot chew, patient cannot bite, then we can give the soft diet to the patient. Certain gastrointestinal disorders, sometimes like bowel diseases, sometimes diarrhea, even sometimes constipation, we can ask the patient to take a soft diet. So mean that their digestive system is not working properly. If the digestive system is not working properly, then definitely we need to explain to the patient which kind of diet they can take, so they can take a soft diet. Then goes to the all at the post-operative stages. Post-operative stages mean after the operation. Once the operation done, the patient has to take a soft diet. Patient, because usually we ask the patient after surgery, we ask the patient to not take a hard diet that is difficult to eat, and then chew, and then biting is needed. So we ask the patient to take a soft diet. So what are the sources of soft diet? Soft diet can be found in a very tender minds, then grounds, and then stew or steamed beef, lamb, fish, cooked vegetable, pasta, soft raw fruits. And then soft raw fruits mean that the bananas are the best example. Then soft breads, and all desserts are soft, or make sometimes we add cheese also, that can be soft diet. So, and sometimes if the patient need the lamb or fish or sometimes chicken need to be given, so it should be cooked in such a way that all the portion, all the pieces, they have to spill down into a small pieces, chewable pieces, which does not need a necessary kind of a biting. So we can add a starch, we can add starch and make a soup. Patient can take that with chicken soup, corn soup, or something. We can add and make it as a soft as much as we can. And then desserts, all desserts, if patient does not have diabetes mellitus, then the desserts, sweet desserts can be given. Then the cooked vegetable mean properly cooked, so that it when we bite, easy to bite, they are already melted down, they are not that much that much hard. They should not be hard, they make it soft. We cook them in such a way that we make them soft. So then the next one is the clear liquid diet. Clear liquid diet is containing of no solid food. No for solid food inside is often prescribed for get gastrointestinal illness, or before or after certain types of surgery. involving the mouth or gastrointestinal tract. So sometimes in a mouth or a mouth surgery, sometimes gastrointestinal tract infection, sometimes the patient is having diarrhea, patient have diarrhea, lose motion, then we ask the patient to take a liquid diet. Don't take a hard diet, then it's very difficult for the patient to digest. And sometimes gastrointestinal tract of surgery are there, then also liquid diets is recommended. Sometimes the patient does have a kind of a peptic ulcer, duodenal ulcer, sometimes small intestine is having problem, so we ask the patient to take a liquid diet, because we need to give energy, we need to fulfill the energy requirement of the patient, everyday energy requirement of the patient. Then we ask the patient to take a liquid diet. Then the indication for the liquid diet is indicated for the operative, post-operative operation, post-operative patients. Then after operation we can give, after surgery we can give a liquid diet. Then gastrointestinal abnormality, gastrointestinal illness, the patient does have a gastrointestinal problem, digestion problem, or patient is having diarrhea, sometimes the bloody diarrhea is there, blood is coming, sometimes to make the stool soften, we can add a liquid diet to the patient. Sometimes the patient digestive system is not working properly, due to maybe sometime the patient is hospitalized, and then a long of time the patient has to take too many medication, that medication all goes to the stomach and it destroy the enteric coating of the stomach. Then we will ask the patient to take a soft or clear diet, liquid diet. Liquid diet can be found into the clear water, then clear sodas, then plain gelatin, honey, then ice pulp, then the tea, coffee without milk or cream. So these are the type of a liquid diet. Liquid diet. Sometimes we consider that if we remove the fat component from the milk, that also can be considered as a liquid diet. Then the full liquid diet. Full liquid diet are the food that are liquid, or are liquid at a room temperature. They can melt it down at a room temperature. It provides more calories than the clear liquid diet. So but still liquid is a stomach and intestinal tract in the which is essential for the patient who cannot chew or swallow the food particles. So sometime post-operative, after surgery, we need to give, or gastrointestinal illness is there, so we need to give this food. So we ask the patient to take a full liquid diet. Full liquid diet can be cooked scissors, can be custards, and can be ice cream. Then it can be yogurt, it can be the all strained food, then the cream vegetables, then the seasoning yogurts and all. So we need to give to the patient. Like yogurt, we can consider is a full liquid diet. So actually liquid, we can blend it and give to the patient. It will give the energy to the patient as well. Then the patient will not feel like the patient is hungry, so all the hunger will go off, and the patient will recover soon. So all the body requirement we fulfill with the help of the diet. So diet can be given in such a way that can, if let's say ice cream also can be, if the patient does not have any problem with that, so we can give ice cream is considered as a solid, but when we give it's kind of liquid, it will melt down to the liquid. Similarly for the custards, it can be custards. We can add some amount of sugar into that. If no kind of not any chronic disease, any blood glucose level, diabetes mellitus is not there, then we can may add some of the sugar inside the custards and give to the patient. Then low protein diet are actually where the patient need to decrease the protein. This happen due to sometimes the patient with chronic diseases with kidney diseases or liver diseases, because the protein they will eliminate from the body by the kidney, by the liver has to work more, to digest the protein diet. If the patient is having hypertension, patient is having a chronic kidney disease, patient is having a kidney problem, patient is having kidney failure, the patient is having liver diseases such as cirrhosis, the patient may have hepatitis B, hepatitis C, that all liver diseases So if the patient is having any liver disease, then the low protein diet is recommended for the patient. Then we can give the patient as a low protein diet. So mean that we should take care. We should take care that the patient should not take a more diet, more protein in the diet. We can ask the patient to low protein. Low protein diet can be meat, fish, and the meat can be white meat from the chicken sources, poultry, eggs, or milk, yogurt, cheese, or peanut butter. We can add these, but our main target is to decrease the protein intake to the patient. We decrease the protein intake to the patient, then only definitely the patient will recover soon. Otherwise, if we don't give a proper protein to the patient, sometimes the patient requires some of the protein level to achieve the protein level, and sometimes it is not required. So if the patient is having a kidney disease, or if the patient is having a liver disease, then definitely we should ask the patient to not take protein into the body. Patient should not take a protein. Patient should not take protein into the diet. That is actually recommended. So then the low cholesterol diet, sometimes the patient cholesterol level is very high. Sometimes the patient does have the cholesterol into the food, and the patient cholesterol level is already high. So we need to decrease the cholesterol intake. Then so mean that people with hyperlipidemia, patient is having high level of cholesterol is very high, atherosclerosis, gallbladder stone is there, or patient have a cardiovascular diseases. So in that case, we need to decrease the cholesterol. We need to decrease the cholesterol diet. So cholesterol diet we can decrease to the patient. So then in this kind of patient, we need to give a low cholesterol diet food. So low cholesterol diet food are actually the chicken, or the turkey, or skimmed removed skin should be removed, and then rabbit, wild duck, squirrel, or oats, and then some vegetables also, sunflowers, then safflowers safflowers are there. So they are the sources of low cholesterol diets. So please remember the indication carefully. And because now onward, we will not in your examination also, we will not directly ask the question. We will ask the question in a case study, something like, I will give a scenario. If the patient is having diseases that maybe the hepatitis C, hepatitis B, and then which mean that this disease belongs to liver. If liver disease is there, then what kind of a food intake should be there? So please remember the sources. This is very important portion. Indication, please remember the sources of diet, please remember, and then answer it properly. So later we will have a tutorial at the end of these lectures. We will have tutorial, and there I will explain to you these all things. Then that's all from my side. Thank you very much. You are free from my side. If someone is having any question, please ask. If no question, then you are free from my side. You may leave the class. Okay, that's all. If no question, that's all. Thank you very much. Thank you very much. Then I'm leaving the class. The next lecture, I don't know when the next lecture is. I'm leaving the class. Thank you very much, and bye bye. Your lecture is already there in your LMS portal. You can have a look from there. Thank you very much. Bye bye.